Health Access in the last 5 or 6 years or so has been trying to turn a vacant lot in the lowest income, highest Latino area of Santa Ana into a small pocket park with the first community center in that zip code, and also a sizable park with the half basketball court, areas for children to play with. And it's been a bit of a struggle, but we're getting there, and it seems that hopefully in the next year or so we'll be opening, and that community will have their first community center and park adjacent to their neighborhood. It's community driven. This is an effort that was sparked by a group of mothers who were really frustrated with the lack of physical activity opportunities that their children had. Their children were playing in parking lots, on the street, in places really that kids shouldn't play in. And so they began discussions about how that area needed a community park. Santa Ana is very park poor, and the areas where a lot of the green space is not accessible to certain areas of Santa Ana. So the group of mothers in Latino Health Access teamed up to identify some sort of strategy plan to open up a vacant lot as a community park, and also to, in the long term, open up green space for Santa Ana residents all over the city. So throughout the years, we identified, with the help of the city of Santa Ana, a parcel of land that would be available to be used as a park and eventually as a site for a construction area of a community park. And so we identified that 3/4 of that land was owned by the city of Santa Ana, 1/4 was owned by a local supermarket chain, Gonzalez Northgate Market, and they donated their land after hearing everything that was going on in Santa Ana, the conditions of the children, the need for open space. They donated their parcel of land, and in 3 years it took the city to finally agree to lease us the land at $1 a year for 40 years. And so now we're going to begin construction on a community center and a park that will hopefully open next year. Well, what we're trying to do is pass policies within the city, within the county, that will promote the idea of open space within the city. And so policy is it's a long process. It's difficult to stay energized with. So that was a difficulty for us, is in keeping the community motivated and saying that at the end of the day, whether it's a year, 2, 3, or 4, there will be a park in your neighborhood that will be accessible to you. And it's a difficult process to have to keep people engaged and on board and say, come to this city council meeting, now come to this neighborhood association meeting. Keep telling your story, somebody's going to pick up and hear it. Something that we had to work on was relationship building. We had to identify key stakeholders within the city, and that includes not only elected officials, but city staff as well, the city manager, city attorneys, planning, and public works, everyone. We had to build relationships with everyone so that they understood how important this project was and how the city needed to invest in it as well. So we identified not only the city, but the local business, who also has some interest in making Santa Ana a healthier place. So Northgate, donated that parcel of land with the understanding that this is going to be an investment in the community. The groundwork is the catalyst for policies. It's that example of what we need to start with so that people can get the bigger picture. It's short-term versus long-term. It's easier to understand the short-term, to say we're going to have a park, than it would be, for example, on the other work that we're doing, which is to increase open space overall in the city through a ballot measure, through feasibility reports, and the groundwork of getting a group of moms together to testify in front of city council and say we need a park sparked the idea of this long, broad policy of joint use that hopefully will be implemented in the city of Santa Ana in the years to come. So this will begin as, the one park. It'll be the Latino Health Access Community Park and Center. But what we hope to do is to open up the other available land, which we identify as being school land. So while Santa Ana is built out, there's very little room to build any more parks. What we can do is utilize the assets that we do have, and those are the school grounds. So if we can find a funding mechanism that will fund the opening, the maintenance, and security of schools, then we're going to be able to have community parks in every single neighborhood, and that's going to be, a benefit to the whole city, and hopefully will spread on to the other communities that face similar issues like Santa Ana. My advice would be to identify with a community group, or to come together with the simple, not simple, but with the basis that's already there. There's already moms out there looking for, spaces to play, or for healthy access to, for access to healthy food. What needs to be put together is the idea that that community needs to be put in direct contact with those key stakeholders. And sometimes you do need an organization or individuals who are dedicated to fostering that relationship and to putting people together in connection. So become close with your school board, with your city council, with your healthcare agency, so that the effort can really truly be a community effort.